All right. So we talked about vitamin D and we talked about importance of it. Today, we're going to talk about vitamin D deficiency. One of the most common health problems in today's world is obviously a vitamin D deficiency among many things. Around 3 billion people worldwide and about 75 to 85% of Americans are deficient in this important vitamin. A vitamin D deficiency is associated with multiple chronic conditions like MS, osteoporosis, cardiovascular, cancer, diabetes. And the reason that is so important, it's critical actually to have optimal levels of vitamin D. We're going to talk about what that looks like. Vitamin D is often called a sunshine vitamin. It helps to modulate the immune system. It protects against certain cancers. It induces autophagy. It prevents cognitive decline. It improves chronic fatigue. It promotes bone health. It improves anxiety. It improves depression. It reduces joint pain, improves sleep apnea, prevents endometriosis and PCOS. So we're going to talk about some of these. Number one, we're going to talk about how it modulates the immune system. Vitamin D plays a very important role in our immune system. It's vitamin D is an immunomodulator, which means that it targets various immune cells, including things like monocytes, macrophages, natural killer cells, T lymphocytes, B lymphocytes. These are different soldiers at different levels of your immune system. There are several epidemiological studies that have shown that if you don't have enough vitamin D, you're more susceptible to immune-mediated disorders like chronic infections and autoimmune diseases. So an autoimmune condition occurs when our immune system cannot recognize our normal cells from a pathogen or a malfunctioning cell, and it mistakenly identifies our healthy cells with foreign invaders, and then it starts to attacking our own cells and tissue. This can happen in any part of the body, but specifically vitamin D deficiency has been related to multiple sclerosis or MS, rheumatoid arthritis, diabetes, as well as inflammatory bowel disease. So having enough vitamin D is very important for functioning of the immune system. Number two, it protects against certain cancers. Research has actually shown that vitamin D has cancer protective properties, and these properties include triggering programmed cell death, or what we call apoptosis, and inhibiting cancer cells growth, reducing metastatic potential. So this has been shown actually quite a bit in colon cancer, in breast cancer, prostate cancer. These cancers have been related to vitamin D deficiencies. Another one, number three, is it induces autophagy. Vitamin D is a key hormonal inducer of autophagy. What autophagy is our cells recognizing that a cell is not working properly, it killing that cell, and then cleaning all of that up. So fasting does that in our body. It promotes autophagy, and so does vitamin D3. Autophagy is very important for us to maintain correct biological function, and it's important for us to make sure that we're in homeostasis, is a system of quality control of the cell contents and to eliminate any old proteins, damaged lipids, or any damaged organelles. Number four, vitamin D is so important in cognitive decline. Dementia, of course, it's a group of symptoms. It's usually chronic, mostly progressive, and it's associated with memory loss and other cognitive functions. It is caused with different brain illnesses, and it can affect our thinking, our orientation, our comprehension, our decision-making, our calculation, our learning capacity. There are numerous studies that show that vitamin D may reduce the risk of cognitive decline. Actually, in 2014, there was a study that found that vitamin D deficiency is associated with a substantially increased risk of all causes of dementia and Alzheimer's. Number five is vitamin D actually improves chronic fatigue. So low vitamin D levels, if you have a low vitamin D, you're more prevalent to having chronic fatigue issue. Chronic fatigue is when you're tired, you're worn out, you're drained, you're depleted most of the time. There's a profound and unrelating exhaustion that typically develops over time, and it can be hard to pinpoint when it has first started. So vitamin D is great for improving chronic fatigue symptoms. syndrome. Of course, you know, and we talk and you see commercials about this, it promotes bone health. Vitamin D3 and K2 work together to promote bone health, reduce incidence of fractures, as well as osteoporosis. Vitamin D also has been shown to improve anxiety and depression. So that's number 7. Anxiety and depression are most common mental health issues in the United States, often experienced together. 40 to 60% of people with anxiety have signs of depression. So vitamin D is an important factor in prevention as well as in treatment of anxiety and depression. And number 8, it reduces joint pain. Vitamin D is so important for healthy joint. Joint pain, of course, discomfort, pain, or inflammation in any part of the joint can be called joint pain. The underlying cause of joint pain in most Americans is osteoarthritis and decreased cartilage. And vitamin D3 has been shown to work really well with the cartilage as well as the joint. So what is a healthy sun exposure? Sun is the best source of vitamin D3 in areas where there is sufficient UV exposure. There are several factors to consider in determining how much sun exposure is appropriate. These factors include the portion of your skin that's exposed to the sun, the color of your skin, and the strength of the UV rays. If 60% of your body is exposed to the sun, it is ideal to get about it is ideal to seek about 10,000 to 20,000 units of vitamin D3 from sun exposure. So you got to intentionally sunbathe no less than 3 times per week, according to the following recommendations. If your skin is light, you only want to get about 15 to 20 minutes daily, 3 times a week. If you have a medium colored skin, you want to get between 25 to 30 minutes daily. And if you have a darker skin, you want to get about 40 to 45 minutes daily. Thank you so much for listening to our Talk with a Doc show. My name is Dr. Shireen Banakdar. I'm your brain-based chiropractor, also a functional medicine nutritionist and detox specialist. Please join us on any of our show. You can go ahead and follow our website at www.harmonywellness-frisco.com, and you will be able to access our podcast as well as our YouTube videos. God bless you. Remember who you are.